Thank you, thank you, thank you, thank you. Good afternoon, and welcome to the Tony Commander with our Glapohkpa Chesson talk show. This afternoon, thank you very much. This afternoon, the topic of my class is healthcare and you. You know, every day in America, we talk about healthcare. For us coming from Africa, some of us don't have a clue as to what that really means. So, since it's a big issue in America, we all talk about healthcare here. It's significant to us here, especially when you live in this country for a prolonged period. You get to know the significance of healthcare and what it means to you and how you need to take care of your health. You know, unlike us in Africa, we take our health for granted. Right here in America, look at the African community. Diabetes, high blood pressure, overwhelming. Why? Because we don't take care of ourselves. We don't take care of ourselves. African people eat sugar. We don't care about monitoring our sugar. You know, you go to parties, they got Diet Coke or no sugar Coke. People don't want it. People want the real Coke. Whether they got diabetes or not, they want the real Coke. And that ends up hurting you. Look at it, all we eat. Africans, we eat a lot of sugar. We eat a lot of salt. We eat a lot of oil in our food. All those things harm us. The oil is fattening. The sugar, diabetes, the salt, high blood pressure. We end up dying from those things because we don't monitor ourselves. Some of us know we got these problems, but we still eat sugar. We still eat a lot of salt in our food. And in America, everything is salt and sugar. Everything is salt and sugar. Because the people like taste in their food. They like sweets. So everything is sugar and salt. So you got to be mindful of that. So let's start my class. What is healthcare? We talk about healthcare all the time. Healthcare is a fundamental human good because it affects our opportunity to pursue life goals. It reduces our pain and suffering. It helps prevent premature loss of life and provides information needed to plan for our lives. That's a big scope of what healthcare is all about. Okay? It's a fundamental human good. It affects everything in our lives, our whole life goals. It reduces pain and suffering. It helps prevent premature and loss of life. And it provides information needed to plan for our lives. It's significant. And for us in our society, we need to know this. Society has an obligation to make access to an adequate level of care available to all its members, regardless of ability to pay. So what is this saying? Whether we got money or not, it is the responsibility of the state to provide adequate level of care to all of us. To all of us. It's just that in Africa, in Liberia especially, where I'm coming from, we don't know all these things. We don't know our rights. When you don't know your rights, the government take advantage of you. The government does what it wants to do and not what it's supposed to do. Okay, there's a difference. What the government is supposed to do is imposed upon it by constitution and laws. And what the government wants to do is it depends on its own will and caprice. So if you don't know the law, the government will do what they want to do. But if you know the law, and you understand your rights, the government will be compelled to live up to its obligation. And under the law, under good governance, society has an obligation to make access to an adequate level of care available to all its members, regardless of ability to pay. So, whether you can pay or not, when you're sick, you get up and go to the emergency room. They can't turn you down. Even in America, they will not turn you down. When you're sick, you don't got money, you alien or anything, get up and go to the hospital. They will not turn you down. Okay? Whatever will happen after they take care of you and see you back in good health. But they will not turn you down from the emergency room or tell you to go because you don't have money to pay. Okay? So that's it. Healthcare. We know that when you talk about healthcare, when we talk about anything, there are different meanings. So I've given you the basic meaning of healthcare. Okay? It comprises its purpose as well. What's the purpose of healthcare? To take care of us, to give us adequate health, to protect us from pain and suffering, to protect us against premature loss of life, and to give us the information needed to advance our lives. That's the whole concept, the basic concept of healthcare. Healthcare is a broad set of services. This is what distinguishes healthcare from medical care. When we talk about healthcare, we are looking at the services that are provided to people in the society. It's services. Okay? When we talk about services, it's different from medical care. That's what distinguishes healthcare from medical care. Medical care is treatment by a doctor, a nurse, or a professional, a medical professional. That's medical care. Healthcare is the services that are provided by the health institution to the public. Okay? Healthcare is a broad set of services that includes acute, chronic, preventative, restorative, and rehabilitative care. Okay? Let's go through this again. Let me see if I got it here. Healthcare versus medical care. Healthcare is a broad set of medical services. Okay? That's the difference between healthcare and medical care. Healthcare is for services provided to the public. Medical care is treatment by a doctor or a nurse or medical professional. That's the two differences. One is service, one is treatment. So healthcare is a broad set of medical services, including acute, chronic, preventative, restorative, and rehabilitative care. Okay? These are all the cares that are provided by the hospital. When you go to the hospital, if you got illness, they give you acute service, they give you chronic service, they treat you for chronic ailment, for acute ailment, they give you preventative service, they treat you to prevent diseases, they treat you to restore your health, they provide services of that, and they provide rehabilitative services to get you back on your feet and walking again. So these are all the services the hospital provide. These are not treatment. These are the services they provide. Okay? Medical care is provision of what is necessary for a person's health by a doctor, nurse, or medical professional. So there's a difference. That's the difference. Healthcare is services that the hospital provides or government provides, and medical care is the treatment that the doctor or nurses or medical professional provides you when you go to the hospital. So that's the difference. Okay? Let's move on. Medical care. I told you all that. All right, that's in my notes. Anyway, let me go on. The basic health care. One, what is the basic health care? One, physician provides services, including consultant and referral services by a physician. So that's the healthcare service the provision provides. They provide services. Okay, they can consult you, they can refer you. Okay, they got consultant and referral services. So if you, like me, when I get sick and I need a special doctor, like I need to go to a kidney doctor or heart doctor, I call my primary doctor. That's why in America you got different doctors. You have your primary doctor. Your primary doctor is the doctor that you call for everything in America. Everything. You want help with other doctors, you call your primary doctor. And your primary doctor will make the referral. They call that referral. If you want to go to the heart doctor, you call your primary doctor and tell him, I need a heart doctor. And your primary doctor will find a heart doctor for you, and he will refer you to the heart doctor, and the heart doctor will call you in 1 week and say, your doctor refer you to me, and they will give you a date to come and see them. So that's how they do in America. Okay? So those are the services the physician provide. They can consult with you and they can give you referral services. Okay? 2, they can do outpatient and inpatient services. Okay? So the healthcare service, you have the physician is one, the outpatient and inpatient service is another one. That means you can go in the hospital for overnight. Okay, that's inpatient. Outpatient, you just go to the hospital for the day and you go home. Okay. They got medical necessity emergency healthcare services. Those are medical emergency services. The hospital provides that. Okay. So these are the services provided under healthcare, under basic healthcare. Physician service, inpatient, outpatient service, short-term service, not to exceed 20 visits. That means if your outpatient visit is not to exceed, if you don't go there more than 20 times, that's short-term visit. Okay, when you go there more than 20 times, that long-term visit. Everything is systemized in this country. Okay, so outpatient evaluate and crisis intervention, short-term, that's short-term. Okay, health coverage. What is health coverage? All of this come under health coverage because your health care services in America depends on your health coverage. That's why insurance in America is an important asset. Everywhere you go, as soon as you go to the hospital, you go to any doctor, the first thing they ask you for your insurance card because you will not pay cash. Okay, they got something here called out-of-pocket payment too. But you're not going to pay cash. Most of the people here don't pay cash. They got medical card, insurance card. You go to the hospital, they ask you where your insurance card. You show your insurance card. It comes with your medical card. Okay? Everybody in America who got medical care has an insurance card. You either got Blue Cross, Blue Shield. I got United Care. Different people got different things provided by the government. Okay, we'll talk about all of that too. I learned a lot from this thing too, from doing these researches. So health coverage cover all of that. It covers your doctor and hospital services. Most cover inpatient service. Okay, it must cover it must cover inpatient services. That means you can't go to the hospital without insurance, without being covered. You got to have coverage, medical coverage. Okay? When you have to stay overnight in the hospital, you must be covered. Okay? It must also cover outpatient service such as minor surgery in a surgery center. So if you're going to do minor surgery, like in America, a lot of people get skin cancer from the sun and things like that. Some of them do minor surgery. They go to the hospital, they cut it out and take it out, or they do something to it minor. Okay, or you got some other minor, you need some other minor operation, that you got a pimple or something. You can go to outpatients and surgery center for it, but you got to have coverage. The coverage will cover all of that. It will cover your overnight inpatient thing. Our insurance is very important. In America, you can get insurance through your job. You can get insurance through Medicaid or Medicare if you with the government, if the government cover you. Medicare is for the federal government. They will cover you certain things for your health. Medicaid is for the state. You get a state only will cover you for certain things. The state can give you more than the federal government sometimes because you live in the state, you have more access to state opportunities. Okay? So that's the difference here. It must also cover outpatient service such as minor surgery. I told you that. Other basic services are laboratory tests to diagnose problems. Okay? If you got to go to the lab to do testing, the doctor wants you to go test your blood or something, it's covered. All of that cover, everything you're covered under insurance. And we'll talk about the different types they have in this country. Though basic health service program states through basic health care programs, state can provide coverage to individuals who are citizens or lawfully present non-citizens who do not qualify for Medicaid, CHIP, or other minimum essential coverage, and have income between 133% and 200% of the federal, this is the federal government, of the federal, let me see it, federal poverty level. So there's a federal poverty level in this country. If you fall within certain bracket, the state will take care of you. Okay? So let me repeat what I just read. Through basic health care programs, states can provide coverage to individuals who are citizens or lawful present non-citizens who do not qualify for Medicaid, and CHIP, or other minimum essential coverage, and have income below the federal poverty level. Okay, so the state's supposed to provide these for you in America. I told you, the state's supposed to provide essential health services to all of its members. It's law. It's law. That's the job of the state, to provide health care. Just like in Liberia, why you think most of us can't come home? The healthcare system is kaput because of the corruption, the stealing, the mismanagement, the ignorance, the negativity in the country. People don't value healthcare. So people like us who understand the value of healthcare and what it is to our lives and our standard of living, will not come to Liberia because there's no healthcare system compatible to giving us what we need to survive. Okay, let's move on. So you know, the state can provide these things for you. Okay, so what does healthcare include? Healthcare includes provisions for food, drink, warmth. In America, because of the cold, the state got to provide heating centers. When it's cold outside and people ain't got a place to stay, or your heat in your house not working, or you don't have money to pay for heat, the government got heating centers during the cold. when it's cold in town, government open the heating centers. They got convention centers. They got halls. They got churches. They got places that people can go who don't have heat in their house to keep warm. That's a responsibility of government. People die from the cold. They don't want people to die. The government will be held responsible. So the government provide heating centers. If you don't go there, that's your responsibility. But you can't say the government didn't provide it. And the government put the information out. Heating center on the street, on that street, on the street. It's cold. Go there. Get warm. Sleep in there. You go there. So those are the obligations of the government to provide healthcare services that includes food, drink. In Rhode Island here, we got a lot of food pantries. Okay? Sometimes private citizens can provide it. We'll talk about that too. The different kind of insurance they got. Some are public, some are private. Okay? In Rhode Island here, they got private places that provide food. They got a food pantry. They got places that provide hot meals. You hungry? You can go to one or two places in Rhode Island. They will give you free breakfast, free lunch. It's free. You gotta pay 1 cent. It's decent. It's well-cooked meal. It's clean. You go sit down, get a plate. They will not even ask you your name. They will not ask you nothing. Just go get a plate, get in the line, come, they will give you food. You sit down, you eat, you put your plate down, you go. You can do that every day. Every day. They got a special time. They serve breakfast 8 o'clock and they serve lunch 11:30. You go there these times, you got to ask no question. Nobody will say anything to you. You got to know nobody. You just go there, get online, take a plate. They will give you food. They will not ask you no question. Okay? These are private people that provide it for the public. Okay? So public and private people can provide for the public, can provide health care for the public. So food, drink, warmth, shelter. I told you when it's cold, they give you shelter. We call it shelter. They tell you go to this place and get warm. Go to this church. Go to this hall. Go to this convention center. Those are shelters to keep you warm, for you to sleep overnight. Okay, the health care includes clean and appropriate clothing. You can't wear dirty clothes. How you survive? You gotta be protected from diseases and germs. And finally, adequate personal hygiene. Toothbrush, toothpaste, soap. Those are adequate things. To take care of your personal hygiene. Okay? So those are the things health care includes. That the government or private people provide to the public. Okay? So basic needs for health and safety include freedom from trauma, violence, and addiction. You hear what I say? Basic need for health and safety include freedom from trauma, anything that will bother your mind, anything that will disturb your mind, that will make you crazy or cracky or behave abnormal. That's trauma. Okay? We don't want anything bothering your mind from trauma, from violence, and from addiction, drug addiction, prescription addiction, any kind of addiction. You got to free your mind from that. Okay? The basic patient care. 1, taking vital signs. Let me see. May I note that? Yes. No, that's the models. I didn't do one about that. Okay. The basic patient care. 1, taking vital signs measurement. When you go to the hospital, what do? They take your blood pressure. They take your your oxygen level. They take your temperature. The 3 things they do that, your vital signs. They want to know if you're alive, if your pressure within limits that are normal, your oxygen level is in normal. Those are your vital signs. Anytime you go to the hospital, that the first thing they check your blood pressure, your temperature, your oxygen level. They test your vital sign. Okay, those are the basic patient care. Secondly, they assist with daily activities like bathing, feeding, toileting, administering medications, wound care, and constant monitoring of the patient's health condition. So those are the three things, the two basic things that patient care covers. One, your vital signs measurement. Two, assist with your daily living activities, bathing, feeding, taking you to the toilet, administering your medication, taking care of your wounds on your body, and constantly monitoring you. You go to the hospital, those are the things they do right there. Okay? These are just stated here. And what is the goal of all of that? To maintain or improve patient well-being. Okay? The whole purpose of patient care is to improve and maintain patient well-being. Okay? They want to make sure your health improve, your well-being improve. So that's why patient care is a necessity. What is patient care? Taking your vital measurements, your vital signs measurement, and helping you with your daily activities, bathing, toileting, feeling, administering your meds, monitoring your constant health condition, wound care, and all of that. Okay? So there are two basic types of healthcare. One is traditional, the old way, okay, the indigenous way, the traditional way. And the other one is the modern way, the Western way, the modern Western way. Under the modern Western way, there are four types of healthcare systems. Okay, every country got its healthcare system because of the prolonged nature of the services provided when it comes to healthcare. All of this falls on the system. They have systematic way of doing things. And these systems were developed over years by people. The four types of systems, I will tell you. One is the beverage system. It was developed, they call it the beverage mode. The beverage mode. That's a healthcare system. There are four types. Okay. In America, we use all four types of the system in different areas. Okay. But different countries use different types of the same healthcare system. Beverage mode. The beverage mode of healthcare was developed in England by by a man called Beveridge. He wrote about it, how healthcare systems should be done, how the economic situation impact healthcare and all of that. And people adopted that system. Okay, the beverage system is from the UK. The other system is the Bismarck system. It's named after the head of the Ottoman Empire, Bismarck. Okay, I can't remember Bismarck's first name, but it's named after Bismarck, the head of the Ottoman Empire. He established a system, a healthcare system for his country that other countries adopted. So it's still being used today. So it's called the Bismarck mode. Okay. The third mode is the National Health Insurance mode. That's the third system of healthcare. And the final system is the out-of-pocket mode. Okay. What are these systems? I will not go into each of these systems because you know when you're talking about system, it takes a lot of time. But what are these systems? These healthcare systems are systems that incorporate public sector finances with private sector finances to create insurance modes for the public to have health care. Okay? So, some of these modes, the beverage mode, I think the beverage mode is a public, I don't know, is a public or private insurance mode. All of these modes incorporate different aspects of private insurance and public insurance. When they say private insurance, that means the taxes from people will help to set the insurance up. When they say private insurance mode, that means private people and organizations get together and put money together to develop insurance company to help people with health care. So you have the government on one hand and you have private sector on one hand. Okay? Sometimes the government can provide the health care, but the private sector provides the facility. The private sector will provide the hospital, and the government will provide the doctors and the medicine and all of that in the hospital. So those are the different modes of services that exist. In America, they use all four modes. They use the base mark, they use the beverage, they use the national health insurance mode, and they use the out-of-pocket mode. What is the out-of-pocket mode? The out-of-pocket mode is where people have money to pay their own insurance, and they do not have insurance policy. They pay out of their pocket. They have money, they're working, they can afford it. So when they go to the hospital and they charge them, they take their own check and write a check. If you don't have money, you will not get services under those systems. So if that is system in your country, in your state, out-of-pocket mode, that means when you go to the hospital, you pay out of your pocket. There is no federal insurance, there is no private insurance to help you. You got to pay. You don't have money, you will not get health care. Okay? But under the beverage, the base mark, and the national health insurance coverage system, you have access to both public and private insurance. So that's just all of that in a nutshell. Those four types of health care deal with insurance coverage, the kind of insurance coverage you will get. Okay? In America, we use all four. We use the beverage, we use the base mark, we use the national health insurance coverage, and we use the out-of-pocket insurance and out-of-pocket payment. It depends on where you are in America that you will use these. But depending on where you are, depends on what kind of insurance company and policy or healthcare system you will be subjected to. So basically, that is healthcare in a nutshell. So all you got to remember is that healthcare is a basic human good that ensures that you are healthy, okay? That you do not have pain and suffering, okay? That you are not subjected to premature life issues. You get the information you need for your life advancement. So that's basic health care. I hope you learned something. I hope you benefit from this. I tried my best to teach you. I also learned a lot. I didn't know most of this. Now I know. And I hope you know as well. Thank you for joining me and have a good day. We'll meet again. I'll talk to you soon. It's been a pleasure serving you.